Welcome back, everybody. You've been emailing us throughout the show, so let's get some of your questions answered, some more of them. Please welcome back cosmetic and family dentist Dr. Terri Alani, general medicine and anti-aging specialist Dr. Bruce McClendon, ear, nose, and throat specialist and allergy specialist Dr. Raza Pasha, primary care physician Tejpal Grover, and pharmacist Gina Eubank. All right. We're going to start with, because, you know, we'll take advantage of the fact that you're here, too, our audience coordinator, Chaz Miller. So, Chaz, you've been having some issues.
All right, Dr. Pasha, about a year ago, I got a sinus problem. And it was cool because I had this real cool gravelly voice because I couldn't clear my throat. But the problem is, within the last year, the gravelly voice has gone away, but the throat problem's still there. So for like a year, it's felt like I can't clear my throat. And it's a minor annoyance to me. But there's this,
but in the office, we were sitting there.
There's this guy in the office. He's a little fussy, a little grouchy. He likes to call me out on it. So this is really for him. So how can I fix this? And what's
the problem is what you need to start with, yeah.
Well, the first thing is since it's lasting a period of time, we need to take a look at your throat itself. So you need to come in and we can take a small scope and take a look at your voice box to make sure there's nothing going on there. But more than likely, it's going to be one of two things. One is, as we mentioned, allergies. And this is the season. And number two is you can have what's called reflux, or actually silent reflux, or laryngopharyngeal reflux is the medical term for that. And what it means is that you get acid that bathes your throat. And what happens, it makes it very, very sensitive. And you get any kind of postnasal drip or any kind of irritation, you want to clear your throat. The second most common symptom that you have is you have itchiness, or even more common than that is you feel like there's something stuck in your throat, or a foreign body or a globus sensation. So my bet would be reflux, but the way to check is we need to take a look at your voice box.
Thank you.
Sure.
All right, now we're going to go to our audience. We have several of them that kind of have a related question, so go ahead and ask your first two.
I wanted to ask, at what age should we really be checking our blood pressure, and can we...
do those pharmacy machines.
Yeah, those little pharmacy machines, are they really accurate?
Okay, hold on, and then you wanted to know.
I was just diagnosed with high blood pressure, and I wanted to know if I'm going to be on this medicine for the rest of my life, or what can I do to keep my blood pressure down.
All right, so let's start with this one. Is she going to be on high blood pressure medication for the rest of her life?
Okay, we don't have a cure for high blood pressure. We do have ways to control it. Now, the mainstays of controlling it are, number one, medication, but number two are diet, weight loss, and getting the salt out of your cooking. Okay, so we want to have you lose weight. We want to have you cook without salt, get the salt off the table. We want you to exercise as well. Each one of those interventions can bring down your blood pressure somewhere between about 7 to 10 points if you're doing it really well. So if you have mild to moderate high blood pressure and you can use those methods to bring down your blood pressure, you could get off the medication. Now, we still consider you as having quote-unquote high blood pressure, but you can avoid being on medication that way.
All right, and Gina, do those machines at the pharmacy really work?
Yes, they do work, but like everything else, you have to use them properly. And a lot of people, they'll stick their arm in there, but they'll be, you know, yelling to their kids or their husband, hey, no, I didn't want that, or pick up this. So, you know, you keep your arm there and you hold it still. And also you have to take into account if you're taking any other medication, you know, like any sinus medication or anything like that.
So that's really kind of like a benchmark, but you really have to go to your doctor to get checked. And Dr. White, you guys check. We
check blood pressure every time the patient comes in, or at least every time they come in for their cleaning. So that is a great way to have your blood pressure checked just when you go to the dentist.
You've actually sent people straight to the hospital.
Absolutely, yes, we have.
Okay, let's go to one of our sound bites from someone who had a question.
I'm a type 2 diabetic. I have high blood pressure. I wondered if there was a diet plan that could help me lose a little weight, drop a few pounds. I really would like to, but I want to do it the right way. Can you help me?
All right, Dr. McClendon, type 2 diabetics, which we used to call adult onset, but now we're seeing it in kids, so we don't call it that anymore, but is one of those, luckily, things that you can get rid of or suppress.
Yeah, diabetes is tough. It's a lifelong disease, and you really have to have a lifelong diet. Too many people want to go on a diet, but it's really a lifestyle, and you have to eat the right kinds of foods, the right portion sizes, and if you do that on a regular basis, you're going to lose weight. You know, we get these Texas portion sizes. We eat, you know, chicken fried steak with French fries, and have you ever done that?
What's
wrong?
I mean, yeah. And what's wrong with that? And you know,
what's wrong with that?
You know, the thing is,
everything is wrong with that. I mean, too much salt, too much fat. You know, that's our diet right now. So it really takes a lot of focus on what you're eating, and when you're eating it and eating the right kinds of food.
Yeah, and we put too much emphasis on the aesthetic value of losing weight as opposed to health. All right, we have time for one more email question. This email question is for Dr. Alani. Is brushing my teeth after every meal harmful to my enamel? That comes from Joel in Channelview.
No. Make sure, as I said earlier in the segment, make sure you use a soft toothbrush so you're not bearing down, because if you do bear down, you can cause gum recession and cause abrasion and affect your enamel. The other thing is the only time you would not want to brush your teeth directly after is if you're drinking red wine. Because
it kind of sets the stain?
It has to do with the acid. It can actually scratch your enamel. So basically, the more you brush, the better off.
All right. Remember, you can find links to the medical panel on our website, greatdayhouston.com. We'll be right back.